everyone. Today I want to talk about a critical issue that does affect us all, regardless if we know it or not, and that is healthcare. So, just in 2023, 26 million Americans, which is like 8% of the population, they did lack health insurance. The current system now, it is complicated because it has like multiple payers, providers, and like different administrators. Um, so according to a report by the Common Wealth Fund, the U.S. healthcare system, it is one of the most expensive healthcare system. Um, After like they did the numbers, it is ranked at the bottom as far as like healthcare outcomes. So like even though they do have like measures that were taken to expand the coverage, still like 8.6% of the US population did not have insurance in 2021. That is still like a really big number after they did whatever measures that they took. So according to Dr. Don Berwick, he is the former administrator of the Centers for Medicare and Medicaid Services. He did say that the biggest waste in healthcare is administrative waste. He did estimate that the administrative costs accounts for like 20 to 30% of healthcare spending. So you have like public figures like Bernie Sanders, different like advocacy groups and other individuals. They did advocate for this single payer system. And what a single payer system is that everyone would be considered under one system like Medicare. So basically the government would like negotiate and work with like drug companies and hospitals to like make sure that prices are fair and that like the costs are being reduced. So this would make like healthcare more affordable. People would have like better access to care regardless of their income or their social status. So according to Dr. Danielle Offrey, she is like a primary care physician. Like she did say that like the most important thing we can improve in healthcare is the outcome to make sure that everyone has access to care. And that is what's really important here, is making sure that everyone gets care regardless of what. So also there was like another study by the Rand Corporation, where like a single payer system could save the US up to I think like 1.8 trillion over the next 10 years. Like it's obvious here that the impact is the people who are struggling to access care because of what the cost is, and the cost is too much. And it's clear that like the solution possibly could be to have a single payer system where like one organization is paying for everyone's health care. Other places like Canada and like they have that implemented and it works for them. So like as far as like the statistics for the US, like 212,000 American lives could have been saved with like universal healthcare system, and like 105 billion could have been saved in COVID-19 hospitalization in expenses alone. So, and that was in 2020. So also 4.438 billion, their lives could have been saved yearly with a single payer system in the non-pandemic years. So like statistically, the doctors and researchers are saying that having a single payer system would just like be essentially better. So what the system looks like is like it has like a practice that would involve expanding Medicare coverage and Medicare. They would negotiate prices to get everything at a lower cost so that everything would be like convenient for everyone. So basically we need like lawmakers, policymakers, all of those people to like work together, and create a new system. And what this would do is like it's prioritizing patient care. And that's what this is about, making sure that the patient in need is getting the care that they need. So, you know what I mean? Like, in conclusion, what this is like a better, it means like better care, more access, and it lowers the cost for everyone. And it's putting the patient first and just making sure that everyone is having access to the care that they need when they need, and it will not be like a financial burden. So this is what the single payer system would essentially do for everyone. Thank you.